The town I grew up in was Rockford, Illinois, blue collar, very down-to-earth town. My father is a physician. My mother is an occupational therapist. And so there was always the undercurrent of healthcare in the family. The summer before my sophomore year, I was doing what college kids do when we were out and about.
At about 2:00 in the morning, I got a phone call from the emergency room and then what was Southern Baptist Hospital. And I was called to see a patient who was involved in an automobile wreck and had substantial second and third degree burns as well as pulmonary burns.
There was chaos in the car, and I don't exactly remember what happened in the car, although I caught fire and I was stuck in the back seat in a car that was engulfed in flames. And so I climbed out the sunroof and jumped off the car and ran away to the sidewalk where I collapsed.
It seemed like they were all primarily deep second and third degree burns.
I think like everyone else in the building, didn't think I was going to make it, but he said he saw some fight in me, and then they sprung to action. And this hospital, without a burn center, was able to rally the resources and get me through it. So I got back to college 1 year to the day that the accident happened, and that was my goal. I knew that if I didn't get back within a year, I would never go back, and then I didn't know where I was going to end up.
He asked me, or told me maybe, I think he probably told me, I don't think he asked me. He might have asked my opinion about what he said, but he decided he wanted to go into medicine. And I think that's when his real spirit showed.
Ultimately ended up as an ICU fellow, critical care fellow. The most formative experience of my journey as a patient was being in that ICU. That the hours of struggling to make it through was a classroom for me.
I think he learned a lot in that horrific 3 months.
As a provider who's had a patient experience, there's just a whole different set of perspectives as to what it means to be a patient who is critically ill, who is at risk of death, whose family is there without the knowledge and who's asking questions. So this is probably a note from a patient, although it could be hate mail. Dear Dr. Busse and the ICU team, thank you so much for everything you did to contribute to my mom's healing. Your expertise, patience, and understanding is greatly appreciated.
Not only going to medical school, but then getting a residency and doing an incredible amount of research that he's done over the years. And not only survive, but to just become the outstanding human being and the father of 2 beautiful children. Anyway, that's his spirit as I see it.
Life is fragile and fleeting, and you only have one. And so I would say, make the best of it. Leave the earth better than when you started, and find your passion in life.